In today's video, I will talk about premature aging syndromes or progeria, a very rare inherited disorder, its types and characteristic features. Premature aging syndromes, also called progeria, include some rare inherited conditions which are clinically marked by accelerated aging process and shortened life expectancy. The term progeria is derived from geras, the Greek word meaning old age. It affects nearly 1 in 4 million newborns around the globe. The syndromes included are listed below: Hutchinson's-Gilford Progeria Syndrome, Werner Syndrome, Bloom Syndrome, Cockayne Syndrome, Mandibulo-acral dysplasia, Progeria adult onset or neonatal, Rothman-Thompson Syndrome, and Seep Syndrome. From the above list, the two types which are explained by the researchers in detail include Hutchinson's-Gilford syndrome and Werner syndrome. Hutchinson-Gilford syndrome is very rare and 1 in 8 million children is affected, whereas 1 in 1 million individuals is affected by Werner syndrome. Signs of progeria begin to manifest in the first year of life by the failure to gain weight and associated skin changes in Hutchinson-Gilford syndrome. In case of Werner syndrome, signs appear around puberty, marked by absence of or delayed growth spurt. The characteristic features of progeria. Both the conditions have similar skin changes that indicate premature aging. The changes occur at an accelerated rate in these syndromes. The changes include: their appearance does not match their age, they have a high-pitched voice, thinning of skin and it becomes inelastic. Due to the loss of cutaneous fat, wrinkles appear, graying and loss of hair associated with baldness and prominent scalp veins. Nail abnormalities, facial deformities include prominent eyes, sunken cheeks, small jaw, and delayed dentition. The affected individuals are short-statured with hunched posture, thin limbs, and prominent joints. They usually suffer from joint stiffness and hip dislocations. The skin over the joint is thickened, tight, and shiny, and easily ulcerate. Now, the cause of progeria. In Werner syndrome, an individual receives a mutated gene from both parents, thus labeled as an autosomal recessive disorder. 1 in 4 offspring may be affected by the disorder and others may carry the mutated gene. Werner syndrome is caused by mutation in a gene which regulates a protein called helicase. Helicase plays an important role in the replication and repair of DNA and RNA. In Hutchinson's-Gilford syndrome, both autosomal recessive and autosomal dominant patterns are found. In autosomal dominant pattern, mutated genes are passed on by one parent, and 1 in 2 offspring may have the disorder. Hutchinson-Gilford syndrome is caused by mutation in the lamin A gene, which supports the structural framework of a cell and its nucleus. The resulting instability of the cellular scaffolding leads to premature aging. In this picture, a child suffering from Hutchinson-Gilford progeria syndrome is shown. In these patients, the cell nucleus shows aberrant morphology, as you can see in the bottom right picture. In the top right picture, the normal shape of the nucleus is shown. The complications of progeria. Cataracts may develop progressively between 20 to 40 years of age in majority of the cases. Osteoporosis due to disturbances in the parathyroid gland's activity, diabetes mellitus occur in at least 30% of the progeria patients. Cardiovascular disease such as atherosclerosis and peripheral vascular disease due to stiffening of the arteries may end up in a fatal cardiovascular event. Underactivity of pituitary gland causes hypogonadism or agonadism, resulting in sterility, amenorrhea, or in other cases premature menopause. calcification of soft tissue and muscle wasting. The incidence of cancer is high in these patients, especially fibrosarcomas, carcinoma of the thyroid, meningiomas, and squamous cell carcinoma of the skin may occur. Prognosis is poor with an average life expectancy around the age of 13. Death usually occurs in most of the cases between 30 to 50 years. Heart disease or cancer cause death in majority of these individuals. There is no specific treatment available for progeria. The condition is managed by symptomatic treatment of associated diseases. Genetic counseling is highly recommended for affected families. Thank you for listening. If you like the presentation, make sure to drop a like. Let me know if you have any suggestions in the comments below.